This is a continuation of our presentation on spinal cord stimulation to relieve chronic intractable pain. In the first video, we discussed the circumstances in which such a technique might be considered, and we discussed the mechanism of action of pain relief. In this video, we will talk about the specific technique. In a trial of spinal cord stimulation, a specially designed needle is used in order to gain access to the spinal canal. For a low back or leg problem, the usual site of entry is down here at L1-2 or sometimes here at T12-L1. Once the needle is placed into the spinal canal, a string of electrodes, which are arranged in single file on something that looks like a wire, is threaded through this needle and then advanced several levels up the spine, approximately like that, except it's inside the spine and you wouldn't be able to see it. Once the electrodes reach the planned location, stimulation is applied starting at a very low level and slowly increased until the patient begins to feel stimulation. At that point, communication is essential in order to ascertain whether the stimulation is being felt by the patient in the same area where the patient normally would feel pain. If the problem was in the shoulder or arm, then we would be talking about placement of a needle up here at perhaps T1-2 or T2-3, and advancement of the electrodes up into the neck area, like this, except again inside the spinal canal. Otherwise, the technique of stimulation is identical. So, once the stimulation is found to be appropriate in terms of location and appropriate in terms of blocking at least some of the patient's pain, the needle is very carefully removed, leaving the electrodes in place inside the spine. Then, heavy tape and adhesive are applied to the skin in order to hold the electrodes in place. The patient is then sent home with instructions how to operate the device and a prescription for an antibiotic in order to minimize the chance of infection. A stimulation trial typically lasts 5 to 7 days, and the patient is encouraged to live his or her life as normally as possible in order to learn what impact pain relief might have on his or her life. Things that a patient is instructed to think about include pain relief, activity level, and quality and quantity of sleep. At the end of this 5 to 7 day period, the patient comes back to the office. The removal of electrodes and tape is done quickly and easily, and then a decision needs to be reached as to whether the patient received enough relief to justify an implant. This is a highly individual decision, but typically we like to see at least 50% pain relief. In my practice, about 90% of such patients experience enough relief that they wish to go on for a permanent implant. A permanent implant is done typically by a neurosurgeon. The electrodes that are placed are much larger and wider and more efficient than the small electrodes that are placed and used during a trial. The implant is done typically under heavy sedation or sometimes general anesthetic. There's a connecting cable that is then attached to the electrodes that runs around the patient's side, and a pocket is made in the front under the skin in which a battery or a generator is placed. The whole thing is then sewn shut, and the patient is given a device that is held in the hand. It resembles a computer mouse that is placed over the generator, and the patient can then use the device to turn on and off the stimulator in order to gain control over his or her pain.